Our last guest today is Dr. Robert Colucci, who's with Novant Health Psychiatric Medicine located in Shallotte. Welcome to the show today.
Thank you.
So happy to have you here. I know we met a long time ago when you first interviewed, so it's been quite a while.
Yes, it has. Settling in, but thank you.
Thank you. We're really happy that you're here. So let's introduce you to our viewers. Tell us where you moved from and where you did your residency, things like that.
Okay, I moved down here the end of February, coming from Long Island, that's in New York, beautiful place. And I came down here for, I would say, a better quality of life during my...
I think you'll find that here.
I've noticed that.
Yeah, it's a great place to live.
It really is. Everyone has been very warm, welcoming.
Good. Yeah.
My background has always been in psychiatry, community medicine, trained at New York College of Osteopathic Medicine. After that, I did my residency at, then it was Hillside Hospital. And then from there, I did my child fellowship at Schneider's Children's Hospital, and then went right out into the world of community medicine, did some inpatient work, substance abuse work, but community medicine, community psychiatry is really where my heart is, and that's what drew me here, is their program.
Yeah, that'll be great for this area. I'm really excited that you're here. What brought you to Brunswick County? Just the position, or were you familiar with us before?
No, not really. Familiar with the Carolinas, but I interviewed all over the place, up and down the East Coast, New Hampshire, Delaware, Florida, Carolinas. Wow. Making a big move after being born and raised in New York, I wanted to make sure the place I picked really met my needs. Yeah. And the position really, which did attract me here, the new mental health clinic they have in Shallotte.
So let's focus on the practice. What does a typical patient journey look like in your office? What happens on their first visit?
Okay, usually they are referred from the community, primary care physicians primarily, or through Novant system, through the primary care system there. And when they come in, it's, again, because of the community where we're in, and sadly mental health is so underserved. Right. They'll come in with a variety of problems, most people depression, anxiety, sometimes with mood disorders, a lot of post-traumatic stress disorder, and then they come into the office and I'll sit down with them and really introduce myself, give them a little bit of background about me, being new to the community, and then hearing their story and what their needs are.
So is the visit like an hour, or is it longer for a first-time patient?
First-time visit, patient? Yes. Usually first-time visit is a good hour long. It's flexible, obviously. If we're in the middle of something, I'm not just going to say, sorry, our time's up. Right. So it's about an hour long, and then depending on where we go from there, follow-up visits are 30 minutes. And again, depending on the person and their needs, it could be, you know, in 2 weeks or a month. Usually in the beginning, it's every month.
Do you think that during the pandemic that brought mental health issues to the surface a little more? Do you think that folks suffered more in silence during the pandemic?
That's a difficult question in the sense that...
Well, then forget I answered.
In the reality that mental health, in my mind, doing this for 20 some odd years, has kind of always been in the shadows. It really has been. And people have a very difficult time, you know, discussing that. With and it's usually a primary care physician that will meet them. They'll come in with maybe some medical complaints or concerns, and then things will unveil. But yes, I think COVID absolutely set mental health probably further backwards in the sense that
that's too bad.
A lot of anxiety and other traumas came out, and no place to go for treatment. Difficult.
It is difficult.
Yes, it really did.
Yeah, it is difficult. I know. I guess medication is one treatment option that patients can choose. Is that pretty typical?
You're right. Usually when they come to me as a psychiatrist as opposed to a social worker or a mental health counselor, the goal is, as a referral coming in from primary care, is they're at that point where they've tried everything else.
I see.
and they're looking for medication. And even with that said, I explain to every patient that medication is helpful and it could be helpful, but it's not the answer. You really got to advocate for yourself.
And do you always hit is the medication that you give the first time, is that typical that you stay on that, or do you have to like play with the medications?
Again, sadly, unlike other areas of medicine, there is no one test to say this will work for you. Not a blood test or anything. They have come up with genetic testing, which is kind of bringing us closer to kind of fine-tuning what medication, but usually you kind of know from your experience, their symptoms, what medication will work best, hopefully. But unfortunately, I do explain that too also up front, is that maybe the first medication won't help. Be patient. You may have to try one or two other medications.
What happens with a patient who is in crises? And end up in the emergency department or something like that, then would they be referred to you?
So for us as an outpatient center, right, if it's an emergency, then yes, either, again, I'm getting familiar with the area, there'd be like a mobile crisis would come in, or they hopefully maybe a family member would bring them to the emergency room, and then from there they would then, depending on the situation, hopefully not need to be admitted, but if they need to, they need to for their own safety, but then could be referred back to us or another facility in the community.
This is such great information, and it's really a new topic for us. So I would love to have you come back, because there are just so many more questions about mental health in general, especially in this area. Will you come back?
Oh, 100%.
Great.
Absolutely. Thank you.
Do you need a referral to see you? I forgot to ask that.
Yes, everybody would have to be referred to the program, 100%. So either from the primary care center that they're going to, or through Novant directly.
Okay, good information. Thank you so much again for being here. It's my pleasure having you.
Always, thank you.